obviously there is a huge rift across America about what the law is and what the law does. So, many of us in my own party had differences of opinion on how we ought to get to the next place when it comes to the Affordable Health Care Act. But here's the thing we're going to have to deal. We're going to have to deal with some certain issues along the way. The very first is the rollout of it. It is not working, unfortunately. There's been more cancellation of health care plans than there has been enrollees. I don't care if you're for it or against it, that's a problem. And once the next phase goes in, and what we're seeing is the individual policy cancellations and the sheer number of businesses that are sending up flags that they're going to have to cancel their plan for their employees, pay the fine, and move them into the exchanges. All that is real. That's not hypothetical. That's not things we're going to chat about or argue about if you're for it or against it. These are real consequences of what the health care law is going to do. So many, like me, argue these are issues we're going to have to deal with.
I think we also need to remember where we started. In this state, there are 1,200,000 uninsured. This has been going on for decades, and it had to change. And what was proposed was a combination of expanding medical care through Medicaid and through the private insurance sector. Those two pieces. Of the 1.2 million people, the estimate is that 700,000 will benefit from this through expanded Medicaid, delayed in this state, and the CHIP program for children. Another 300,000 are going to be eligible for tax credits. So there's going to be, once this begins to work, a very substantial diminution in this state of what was totally unacceptable. Over 1 million people going to bed without health insurance and essentially going to emergency rooms, not having the preventive care that is so essential and that most of us benefit from.